Hello, everyone, and welcome to the Surgical Ergonomics podcast, where we will be discussing everything related to surgical and procedural ergonomics, the people, ideas, and technology that will help enhance your physical wellness and career longevity. I am your host, Geeta Lal. I'm an academic endocrine surgeon, speaker, consultant, and surgical ergonomics coach. Having experienced work-related musculoskeletal injury myself, I am committed to increasing awareness of and developing solutions to counteract the impact of poor ergonomics on the professional and personal lives of healthcare workers in procedural areas. This episode of the podcast has been sponsored by Sunoptic Surgical. In many ergonomics discussions, we focus on positioning, but wearable technology and visual demands play just as important a role, especially during longer procedures and over the course of a career. Sunoptic has focused on surgical headlights for over 45 years, designing systems with balanced weight distribution and adjustable fit, including 5 different headband options. This flexibility allows surgeons to choose what feels stable without overcompensating. Sunoptics also focus on uniform, high-quality light output to support clear visualization and reduce overall visual strain. Those combined factors can help reduce fatigue and support long-term sustainability in the OR. If this is something you're thinking about, you can learn more at sunopticssurgical.com or clicking their logo on my website podcast page at surgicalergonomics.com/podcast/. Hello, everyone, and welcome to another episode of the Surgical Ergonomics podcast. In today's episode, I'm very happy to have as our guest Dr. Sara White. Dr. White is a 1998 graduate of North Carolina State University College of Veterinary Medicine and has worked in a mixed animal, small animal, shelter medicine, and high-quality, high-volume Spay Neuter practice. Then, since 2006, Sara has operated Spay ASAP Inc., a nonprofit MASH-style mobile spay neuter clinic, and has spayed or neutered over 76,000 animals in Vermont and New Hampshire during that time. During the course of her career, she developed an interest in health, well-being, and injury in veterinarians and staff, and completed a Master's of Science in Health Ergonomics from the University of Derby in the UK in 2015. She has been named Veterinarian of the Year by the Association of Shelter Veterinarians in 2018. She has co-authored both the 2008 and 2016 Association of Shelter Veterinarians Spay Neuter Guidelines and is the editor of the textbook High Quality, High Volume Spay and Neuter and Other Shelter Surgeries. Hello, Sara, and welcome to the podcast today.
Thank you. I'm very happy to be here.
Wonderful. So, Sara, I've heard a little bit about your background as I went through your introduction. I was just wondering if you could kind of share with your listeners a little bit about yourself, including kind of where you grew up and, what attracted you to veterinary medicine. And then how did you actually become interested in kind of the ergonomics or wellness part of veterinary medicine?
Okay, so I grew up in North Carolina, and as a kid, I was always interested in animals, definitely interested in science. I got involved in my local 4-H club and competed in horse competitions. I think that at that time I was definitely considering being an equine veterinarian, but was also very interested in research and considered being a research biologist, considered maybe going into human medicine. In college, I actually took a course called The Social Context of American Medical Practice. And after learning more about the sociology of the structure of American medical practice, decided maybe that wasn't where I wanted to be, and that vet medicine was going to be a little bit more direct or less complicated way to do medicine. So I went to veterinary school at North Carolina, and as veterinarians, usually, especially at that time, it was unusual to do internships and residencies. Most of us graduated and went out into some type of general practice.
I see.
And I finished school, went to a mixed animal practice in Vermont, worked in Vermont and New Hampshire. In mixed animal practice, we're seeing cats and dogs and also guinea pigs, birds, cows, horses, and alpacas, sort of every animal that's out there. And it was a great experience, and it was also a lot. There were so many species and so many different types
Yeah.
of work that we were doing that I found I really needed to focus on a smaller area,
Hmm.
and to leave the horses for recreational and not professional parts of my life. When I finished at that practice, I started volunteering at a local humane society,
I
which
see.
quickly turned into a part-time job. And I was also doing a little bit of small animal part-time work as well. And as that job evolved, I found that I was more and more interested in surgery,
Hmm.
and that I was more interested in being able to provide surgery for animals out in the community and not just for the animals inside the shelter. That there
I
was a
see.
need, whether it was people with with feral cats, unknown cats in their environment, people
Hmm.
with very low incomes who had pets who were unable to get them spayed and neutered, so then they had more pets. I found that within the shelter organization, it was hard to expand services. It was hard to get anything done in a timely manner. And
Mm-hmm.
so that led to my starting my own clinic in 2006. And at that time, I had also met a veterinarian from Cornell University, from Ithaca, New York, who was doing a MASH style mobile clinic, which MASH, in this case, is Mobile Animal Sterilization Hospital, but
I see.
similar concept to MASH, medical hospitals in
Right,
a
right.
war zone. So, what it meant is that I could have all my surgical equipment in my car and drive to a humane society who would host me for the day.
Hmm.
And if they had a space where I could set up, maybe a multi-purpose room, we'd
Hmm.
set up my surgical equipment. We'd do a bunch of surgeries. I travel with or hire a local veterinary technician, depending on where and when in my career. So
I
I
see.
have a professional who is not in surgery, who is able to manage the day, manage the anesthesia, manage the animal
Hmm.
handling parts of the day, and then the shelter staff and volunteers do the rest of the work. If the shelter doesn't have a space where we can set up, we may be in a church basement, in a community center, all kinds of different spaces that might
Hmm.
be, as long as we've got heat or ideally air conditioning when we need it, we've got
Right.
windows that close, we've got electricity and running water, and we've got enough space for ourselves and the animals, and it's a
Right.
space that we can do a clinic in. So I started doing that work in 2006. A huge advantage for me was I didn't have to raise the money for a building or raise the money for a big spay neuter vehicle like the
Right.
buses or camper vans that you see, where they
Right.
actually do the work inside the vehicle. And that I didn't need to hire an entire staff, that if I had my veterinary technician with me and the shelter staff who were already used to handling animals, who were already used to dealing with the public, we could make clinics happen that way. So I started that clinic in the summer of 2006 and was invited later that year to become a part of the Spay Neuter task force that was what wrote the guidelines that high volume spay neuter practice
Hmm.
has been around for a while, but had a bit of a reputation for being really low quality, sort of chop shop, assembly line, all the bad things that you can
I
think of
see.
as far as surgical quality. And that, in fact, it can be a very safe, high quality, can be basically the same as any other general practice,
Practice.
but in this different, more efficient context. That a part of writing the guidelines for high quality, high volume spay neuter, or what later was to become called that,
Hmm.
was to professionalize this area of vet medicine, and to kind of create minimum guidelines and to
Hmm.
create some aspirational guidelines as well. So here I was quite new to the field. I'd been in shelter medicine for 5 years
Mm-hmm.
at
Mm-hmm.
that point, but I was new to really being a high volume spay neuter veterinarian.
Mm-hmm.
And I got to be a part of this group with people who'd been doing the work for maybe just a few years longer than me, to people who
Right.
had been instrumental in creating the field.
Mm.
And for me, that was a huge learning experience and introduction to the field, and thinking about the both the techniques that we use and the systems that we use
Mm-hmm.
critically
Mm-hmm.
was, I think, a lot of what ended up later being my developing interest in ergonomics and in the people who do high volume surgery. And really, for the past 20 years, I've now been fascinated by the people who do the work that I do. And I also, during that task force, got to work on a what was really an epidemiological project with a couple of tenured professors from a couple of
Mm-hmm.
vet
Mm-hmm.
schools. And I, being the one who hadn't published before, who didn't
I
have a
see.
PhD and board certification, was happy to be the one to write up the paper
Mm-hmm.
and essentially learn the publishing process from them,
Mm.
which led me later to feel as though I had the tools and the connections to do my own studies in ergonomics,
Mm-hmm.
to do
Mm-hmm.
my own studies of people in the profession. So that that was actually another key piece in my ending up down the road to ergonomics. So, over the next few years, as I would go to conferences and have conversations with people who worked in high volume spay neuter, I found that a lot were complaining about my neck I can't look
Mm-hmm.
over that way because my neck is sore, or they would have hip soreness in their hands, or they would have these other work related musculoskeletal complaints. And I got interested in how true that was of veterinarians in general, of veterinarians in the field, and of people working in surgery on humans. So I started diving into the literature and found some studies of veterinarians in general and of human surgeons in general that I thought should be replicated in spay neuter veterinarians. So I did that. I created a study, sent it out to over 200 veterinarians, and got a lot of answers about the kinds of discomfort that people were feeling and what they were doing to mitigate it in
Mm-hmm.
their own
Mm-hmm.
practices, and how much of the pain that people experienced were they attributing to their work. Because I think
Mm-hmm.
a big thing is thinking about, okay, well, you've got pain in your hands. Is it because of your job, or is it just affecting your ability to do your job, or
Mm-hmm.
is it a little bit of both? And so we tried to get people to think about that, or I tried to get people to think about that a little bit. So once I was in the process of writing up my results for the survey in that study, I realized that I didn't have the knowledge or tools yet to really discuss thoroughly what I needed to describe, and found I could actually get a master's degree in ergonomics
Mm-hmm.
without leaving my job, without having to travel, go to a faraway city to do the
Mm-hmm.
work. So
Mm-hmm.
I ended up finding that the University of Derby had this online master's in health ergonomics. And it was through their psychology department, which I think is different from what a lot of North American programs may be, more
Right.
engineering focused. But it was actually wonderful to have it in the psychology department, because I think even though I was focus on health ergonomics, on like a lot of physical ergonomic stuff, I got to think a lot about cognitive and organizational aspects of
Wonderful.
ergonomics.
Wonderful.
So I was finishing writing up my study at the same time that I
Mm.
was beginning that ergonomics program, which took me a few years to complete because I was working full time at the
Sure.
same time.
Sure.
But it was a wonderful experience. And because it was an online program, it was a lot of people who were in all sorts of different professions, but who had been working in workplace health and well-being often for years in their jobs. So we had a lot of varied experience in that group.
Sarah, that's amazing, that journey. And I really appreciate you sort of sharing that with us. And it's amazing how sometimes the path finds us rather than us trying to kind of, dig a path somewhere. So I want to let our listeners know, if they don't know this about me already, although I do talk about her a lot, my rescue dog is named Evie, and she's a Labrador mix from the streets of Houston. And, as you're describing, the mobile clinics and how you set up for spay and neuter, I know that she must have had something similar because she came to the shelter or to the rescue in Iowa from Texas, already having had her, spay neuter and all of that done. So many of our listeners have pets or have had pets. And so I want to kind of let them know that they should consider sharing this episode with their veterinarians and veterinary staff when they see them next, because, all sorts of proceduralists, right, are hurting. Medicine, as you said, health ergonomics is a huge field. We happen to be focusing on sort of proceduralists and surgeons in this podcast, but really, it's a broad subject. So let's come back to this study that you referenced that you were doing, and you were reading the literature. So in my sort of brief perusal of the literature, the numbers among vets for like work-related musculoskeletal pain and other injuries was pretty high. I mean, I read numbers anywhere from 60 to 90%. And so I'm interested in hearing your perspective in terms of what you found the numbers to be and what seemed to be the risk factors, both from your study of the literature as well as your own experience. Surgeons and proceduralists working with human bodies, we have sort of environmental limitations, but then sometimes it's the adjuncts that we're using, like headlights, like loops, foot pedals, etc. So I'm interested in hearing kind of what happens on the veterinary side.
All right. So with veterinarians in general, as you said, fairly high rates of musculoskeletal pain.
Mhm.
And I think depending on the studies, some of them have included acute injuries.
I
So
see.
if we're looking at some especially large animal or considering animal bites,
Hmm.
that there it can be a high rate of acute injury that occurs, especially with certain species. So I have read one study, at least, of equine veterinarians, horse
Hmm.
veterinarians,
Hmm.
where they are likely to have at least 6 or 7 injuries that require them to miss work during the course of a 30-year career in that
Hmm.
field. So there can be very high rates of injury. And I think perhaps different from people working on humans, I think veterinarians go into the job knowing that there is a risk of work-related injury. We are interacting with patients who are have the potential to injure us
Hmm.
any
Hmm.
given day. Every day I examine 30 to 50 animals,
Right.
and there's going to be some of them who are nervous, who
Yes.
are not interested in interacting with a stranger, who are intimidated by the environment. So I know that there's a potential for injury with each one of those interactions. And it's part of my job to, and my coworkers' jobs to figure out how to keep everyone as safe and calm as possible, but also to recognize that there's certainly a potential for injury any given day. But to me, the ergonomic type injuries are
Hmm.
the really more interesting ones in a lot of ways, and the ones that are harder to study. Different types of work in veterinary medicine have some pretty different areas of the body that may be more prone to injury. So,
Hmm.
with my study of people who are specifically doing spay and neuter surgery, as you would expect, the neck and shoulders were high risk areas. as were the hands, wrists, and thumbs, and
Hmm.
lower back, but not at a higher rate than surveys of the general adult human population. So
I see.
a lot of humans in general in large surveys feel lower back pain, but the upper back, neck, and shoulder, hand, wrist, thumb pain was definitely more than what you would see in typical surveys and more than what you would see in a general practice veterinarian as well.
I see.
And I think other veterinary specialties or other veterinary areas of practice are likely to have other specific body parts that are more at risk. In my study, the biggest risk factors for discomfort had to do with the number of hours in surgery per week
Hmm.
and the number of years that you were in practice doing the work. So, years in this part of practice, as opposed to the age of the veterinarian.
Hmm.
So,
Hmm.
some of it may have been age related, but if you tease that out, it really turned out that it was years in practice. And it was number of hours, not number of surgeries, that were more important as well. So, for
Interesting.
surgeons who were more efficient, faster surgeons who were maybe doing 10 or 15 surgeries an hour versus 4 or 5 surgeries an hour, it was the number of hours that mattered, not how
Hmm.
many procedures they had completed. And to me, that was a big argument for making the surgery process, both the actual surgical technique and the organizational process that
Hmm.
supported the surgery, all as efficient as possible. So you could complete your surgeries in less time and have less stress on your body.
And we will be right back after this short message. If you're a surgeon or proceduralist finishing your OR days with neck pain, back pain, hand symptoms, or just feeling physically drained, I want you to know something important. These problems may be common, but they're not inevitable. Most of us were trained how to operate, but we were never taught how to operate for decades without accumulating preventable strain or reducing the risk for a career-ending injury. That's why I created the Surgeon and Proceduralist Career Longevity Program, a fully virtual hybrid program that combines small group learning with individualized ergonomic analyses using your own work videos, AI motion capture software, and surgeon-specific recommendations. Just to be clear, this isn't generic ergonomic advice. It's a personalized approach designed around your body, your specialty, and how you actually do your work. If you want to keep operating at a high level without sacrificing your body in the process, sorry, just edit out this last section. I'm going to record it again. If you want to keep performing at a high level without sacrificing your body in the process, or are looking to return to the OR after recovering from a minor or major injury, reach out to me at gita@surgicalergonomics.com to learn more. And now back to the episode. So that's interesting, Sarah, because, if we look at studies of surgeons working on humans, number of hours per week spent in surgery, and depending on the study, number of surgeries, but also kind of number of years in practice made a difference. So what we see is that the work-related musculoskeletal chronic things that we were talking about end up showing up somewhere 10 to 15 years in practice. And it's not that our trainees don't have those sort of, back pain and neck pain, but it kind of gets to a point where it's now chronic and causing issues that need attention at that point. The other thing that, we see in human studies is that there is, I mentioned sort of the adjuncts that we use, right? The headlight, the loops, and does the table go up and down and all of these things. So our environment. And then also the instrumentation piece.
Mhm.
So by that, I mean, the instruments don't always fit the small-handed surgeons or the very large-handed surgeons very well. And the small-handed surgeons are more likely to be women. So we find that women surgeons are more likely, or female surgeons are more likely to experience work-related musculoskeletal pain and injury. Are there any sort of similar studies or correlations that can be seen in veterinary medicine or spay neuter surgery, for example?
I'm glad you brought up the gender thing because I think there are a lot of differences actually between between what I see in veterinary medicine and the human side. And I think a lot of it has to do with technology.
Hmm.
We're using very basic technologies. So I laparoscopy is not typical for a spay and neuter. And just to define spay and neuter, actually, I'm not sure that everyone necessarily knows what we're referring to specifically. And a spay is an ovariectomy with or without a hysterectomy.
Hmm.
And neuter is castration of a
Hmm.
male. So for either of those procedures, we're using a surgery pack that may have between maybe 7 and 10 basic instruments in it. We usually are not wearing a headlamp or loops, although some people doing large scale MASH clinics do end up using a headlight because there is no over the table light.
Right.
So there's a chance that your dog in Houston was spayed at a large spay neuter event that they have several times a year in Houston, where they have several surgeons come from around the country, a stadium, and 500 surgeries in a day.
Okay.
And in those situations, usually the vets are wearing a headlight that is usually a camping light, and but they have a sterile pack containing their 8 or 10 or 12 instruments in it, and basically no other technology involved. And one of the nice things about standard surgery instruments is that they are pretty adaptive, or different people's hands, different hand sizes can fit a needle holder, a hemostat pretty well.
Hmm. Hmm.
That a good decent quality, well maintained needle holder and thumb forceps are going to be pretty low ergonomic risk. They're going to fit everybody's hands who is old enough to be a surgeon. Once you've achieved a size 5 or above glove, you are probably good to use them.
I see.
So at this point, and even 15 years ago, when I did the research for my study, veterinary medicine in general is tending to be more women than men.
Hmm.
The
Hmm.
transition was happening sort of at the transition between the baby boomer and the Gen X generation, is sort of when we switched over to having more female applicants to veterinary schools. So
Interesting.
even by the 90s, when I was in school, my class was mostly women.
Hmm.
And that spay neuter being on the nonprofit side tends to be even more female heavy. And so my research study 15 years ago had 10% men,
Hmm.
90% women. What it meant was that my sample of men was small enough that it was hard statistically to find differences
I
between the
see.
men and women. But with the numbers that I had, there weren't significant differences between men
Hmm.
and women. And I'm not surprised about that, given that we don't have the technology and hand size mismatch that you
I see.
have when you're using staplers or
Right.
laparoscopic equipment, or have rooms that are physically built for larger bodies, for male
Right.
bodies. I do think that if we were to tease out results in studies, and I would love to see it, that we would see some impacts of pregnancy hormone changes and some impacts of menopausal hormone changes that may really affect people's hands and wrists,
Hmm.
that
Hmm.
I just didn't have the knowledge or the power in the study, the
Hmm.
knowledge in thinking of the study and the power in evaluating the study to see those differences. But I know that there are, big changes that can happen in ligaments and tendons because of hormonal changes
Yeah.
that I think affect a lot of us who are doing the work.
Yeah. I
Um,
was going to say that we don't even have that knowledge and information when it comes to surgeons operating on human beings. We are
Hmm.
just starting to scratch the surface. And what was interesting to me is that exercise physiologists have known about that for a long time and tailor exercise routines for their female athletes differently depending on sort of where they are in the menstrual cycle or where they are in like the phase, as you mentioned, of life. But we're just starting to kind of do that kind of work in ergonomics, looking at kind of the effects of pregnancy. But like you said, we know that given sort of high estrogen levels, high relaxin levels, there's going to be an increased risk because of ligament laxity. So hopefully that sort of work will happen in the veterinary literature as well at some point. This is all really interesting to hear because I can't help but notice kind of parallels in our journey. I became interested in ergonomics because of my own injuries and then kind of started delving into the literature. And, it started by sort of developing kind of a basic ergonomics curriculum for our residency program at the institution I was working in at that time. And so that brings me actually to the next sort of query I had for you, which is, did you get any formal ergonomics training while you were learning how to do these procedures in vet school? And is there any sort of attempt to incorporate that sort of teaching now? Because I'll let you know that my teaching for ergonomics during residency was pretty much you're going to be able to smell the liver pretty soon. Why don't you stand up straight? That was my ergonomics teaching. So, we're making that effort to have formal sort of ergonomics teaching incorporated while we're teaching, surgeons and surgical trainees to operate keeping patient safety in mind and how to do things properly. So, I'm just curious what your experience in that regard has been.
Certainly back in the 90s in school, there was not
Yeah.
ergonomics training. And I don't actually know how consistently students are being trained now in veterinary schools. Although
Hmm.
I do know that in some schools, particularly in the shelter medicine side, where they're teaching people high volume spay neuter, that more of the professors are including some ergonomics. And I have spoken with veterinary students or new veterinarians who've graduated within the last few years who already know who I am because they saw a video of mine in their class. And similarly, we were able to incorporate some ergonomics into the second version of the Spay Neuter guidelines. So people who have
Oh.
read that document that is talking about standards of care, but we also added this operations management section that is talking both about, the individual human safety and welfare, and also essentially organizational ergonomics, how to
Hmm.
organize your
Hmm.
program and use feedback to improve your result, for patient safety, for staff safety, record keeping, all that sort of thing. Record keeping, not just in the, Board of Medicine wants you to have a certain sort of record, but
Right.
also like epidemiologically, can you look back at your records and see patterns of complications or see patterns of
Right.
results? So really, and also in our field, a lot of what we're doing is in order to make an effect on the population of dogs or cats as a whole. So, are your interventions actually affecting the number of unwanted puppies or
Right.
kittens in your community?
Right.
So,
Right.
like being able to look at the work we do in all kinds of different levels, from very high up to very like intimately down in the details.
Outcomes
So
research.
Yes, outcomes research. And I think that people who are interested in ergonomics are getting some of that information from that document or from, it's included in the textbook that I edited. And also, there's a large program that is currently run through the ASPCA
Hmm.
that has some in-person training for surgeons and for veterinary students who want to learn how to improve their spay neuter surgical skills. And they have worked with people who help them with ergonomics, who are, and I'm not sure if they're physical therapists or
Hmm. Hmm.
occupational
Hmm.
therapists, or people who are used to training humans in body awareness
Body awareness,
and
right?
in posture, helping them during design their program and interacting with students when they're doing that. So
Yeah.
the information is out there. Another thing is that in my whole career in shelter medicine and spay neuter, I've been a part of online groups where
Hmm.
often isolated in different parts of the world, in different parts of the United States, in different parts of the world. So a lot of our connection is through these virtual connections. And over the past 10 years, I would say, I will regularly see people ask ergonomic questions.
Hmm. Hmm.
And more, I've seen answers come up from other people in the community that are so thorough that I
Hmm.
don't even need to respond anymore to these questions. So the knowledge is getting out there and dispersed, and people are creating their own participatory ergonomics,
I
essentially,
see.
that they're learning what works for them
For
in
them.
their own space and then sharing that with other people. So that I think that there's a lot of on the ground development of ergonomic ideas
Wonderful.
in
Yeah.
different practices. Yeah.
That's so great to hear. Thank you for sharing that.
Mhm.
And, I'm looking at the time. We don't have a lot of time left, but I do want to address something. So, for our listeners, Dr. White and I have something else in common. Recognizing that there was a need, she actually also has a coaching program for veterinarians where she does a video assessment, offers sort of her expertise for ergonomic analysis and recommendations. And what I'd like to do maybe in the last few minutes is have you share what prompted you to start that and, how has it been received and how people can get a hold of you if, our vets are listening to this and if they're interested, how can they get a hold of you? So,
Yeah, so it was actually something that I got this ergonomics degree. I started writing on it. Didn't really know how I wanted to proceed with it. It was something I
right.
was interested in, but
Hmm.
I actually got a request from an organization that employed a bunch of surgeons during COVID
I
when
see.
they were unable to do a lot of the centralized training for new spay neuter veterinarians. So
Hmm. Hmm.
they weren't able to go in person and be with the big group of trainers. And so their department heads were kind of not sure what their techniques were like, what their ergonomics was like, if they were getting into trouble. And so they wanted to be able to provide some coaching for their vet virtually. So that kind of with that request, I started doing that. It was quite interesting to get to do and watch these surgeons do their work. And to be honest, I'd like to do more of the work like that. It seems to be something that I'll do a lot of for a while and then not have requests for it for a while. And I've also been to one organization in person where it was more about how to change the environment of their practice to make it ergonomically more
Hmm.
suitable. How could they change their tables? In this case, it was how could they change their dental table setup and make it more comfortable, because we had talked a bit before about the dental issue. And I think in veterinary medicine, one of the hard things about dentals is a lot of people want to do them on a wet table, which is a table with drainage built in. Those
Hmm.
often don't have any space underneath the table to put your knees if you're
Mm.
sitting at a chair. So people are automatically set up to be bent over and reaching in order to
Mm.
see their patient's mouth. So their knees are getting in the way of the table, and they're automatically set up for this difficult posture. So figuring out how to reconfigure that work and how to reconfigure rooms that are meant to be multi-purpose. And so we did some of that work in person. So yes, I've done a little bit of that work, and I've always held it out as something that as I go through my 50s and as I confront the onset of little bits of arthritis in my hands and tendinopathies in my hands, that I do have something that I could take to a larger scale and that I would enjoy working with people, whether in person or virtually.
Great. So how can they get a hold of you? Do you have a
Um,
website?
I
Could you
do
share?
have
Yeah.
I do have a website, ergovet.com, and you can contact me there. You can learn things on the site. You may not even need to talk to me if you read through the site. I try to be as accessible as possible, and probably email is the easiest way to get a hold of me. I'm not very active on LinkedIn, so not always the best way to get in touch with me, but email is certainly available, and that is available on the website.
Perfect. Thank you so much for being here today and for sharing your insights in ergonomics as it pertains to veterinary medicine. It's been a delight talking with you because we have so much in common. I think this is the first of many conversations. So thank you very much again.
Thank you for having me. This has been really fun talking to you as well.
Please remember to subscribe to the podcast and follow us on social media, Instagram, X, Facebook, and LinkedIn. We love feedback, so please reach out to us for topics, ideas, speakers, or if you ever want to be a guest on the show. Thank you for listening.